Hello, my name is Gretchen Roop, and this is my adoption of electronic health records. So what is an electronic health record? An electronic health record is an electronic version of a patient's medical record or health history. EHRs, or electronic health records, hold patient care information such as progress notes, lab results, medications, medical problems, immunization records, radiology reports, and so much more. They can be easily edited or updated by a physician or patient along the way, and they have access to their medical charts. They can also help prevent errors that could occur due to wrong information being added. Some benefits of the electronic health records are that it helps prevent errors. Like I said before, medical history or documentation errors can be fixed quickly. Health information can be available sooner than retrieving old paper charts. Lab results or imaging results can be accessed sooner than a call from the office or a next office visit. And medical records can be shared from one physician to another physician, or to a different consult. So that's kind of beneficial as well. So how do we know which EHR option best suits the practice that we need? There's many different options to choose from, so it's kind of challenging to pick which one would be best. So there's 6 different steps to adopting a new EHR. So the first step is you want to make sure that the EHR meets the needs and requirements of the job. This may mean making adjustments to an already built system. Another big challenge or step would be to take notes of what fellow employees would like to see in their EHR. Then, once the best selection to suit all needs are made, you can start the changeover. With the help of the IT department, establish a backloading system of patient past and current medical history data so everything can get carried over into one, and you're not trying to struggle to figure out their past medical history or see past progress notes. So you want to establish a time to properly train the staff to the new system and provide an ample amount of time for them to learn how to use it, because it's a learning curve. Support the system, especially through the tough trial and error or learning period. And you also want to support the staff during the changes, because again, it's a learning period, it's a learning curve. It's going to be a time-consuming thing for them to learn this new system, and you want to encourage feedback from the staff as well. So there are several different choices for electronic health records. The first choice that I selected is NextGen Enterprise. It is ranked number 2 in the top 10 EHR software tools. It can be used for single or multi-specialty practices. It's used for scheduling, revenue management, charting, telehealth, practice management, analytic tools, and a patient portal. Potential learning curve during the implementation period is one of the cons to this. NextGen offers safe prescribing and the e-prescribing, the ability to access data from anywhere, reduce coding errors, auto-generated notes to speed up the documentation process, which is huge, and organization of stored documents. All that NextGen has to offer is like a neutral zone, so it's just clicks away. And like with any new process, you want to allot time to set aside for the learning curve of the initial setup and training. The second option would be Advanced MD. It's ranked number 9 out of the top 10 chart. It's a cloud-based electronic medical record software. Everything from the medical records to bills are in one place, so that's beneficial. One of the downfalls is that there's no group messaging, so you can't message from provider to patient or from provider to provider. There's no offline access, there's no barcode scanning, and there's no built-in dosage calculator. So those could be a couple cons to this. One of the positive things, though, is that everything's in a central location. So patient histories, notes, lab and imaging results, all of that stuff is just in a central location, so you don't have to click through a bunch of tabs. It does have decreased charting time. It's automated billing. The third option would be Elation Health. It's ranked number 6 on the top 10 of the EHR software charts. It's another cloud-based system. It's best for small or mid-sized practices. One system has all the clinical and practice needs. It has no offline mobile access and no auto scheduling or voice recording, so that can kind of be a downfall to it. It is AI powered, so it has documentation capabilities to help create generated notes from what the system hears. So as soon as you start to dictate and talk into it, it can help generate notes. It has HIPAA compliant Zoom telehealth visits. You have the ability to e-prescribe, manage referrals. ICD-10 codes can be added to check eligibility right then and there. And patients are able to book appointments, pay their bills online, and see lab results all right there together. So that's one of the big benefits of this type of system. And so the software of choice that I feel like would be best beneficial would be the NextGen Enterprise. Some key features of this to make the software choice would be the documentation speed, the built-in templates for order, progress notes, and SOAP notes to help, again, make your documentation quicker. There's tools used for auto-generated notes based on the visit details, so that helps speed up the documentation process. It has speak-to-text note-taking. Data access from anywhere. It has e-prescribing, drug allergy interaction checks instantly. Patients have access to their chart, scheduling, lab results, referrals, bills, etc. In summary, NextGen is the ideal electronic health record. Benefits outweigh the cons of longer training and the learning curve associated with the learning of a new product. NextGen provides ease to charting documentation, patient access, messaging system, and so much more. The speak-to-text note-taking and auto-generated notes will make for a speedy documentation process. NextGen also offers e-prescribing and the ability to have virtual office visits. The mobile app offers the opportunity for physicians to see a chart or message while away from the office, and all of these benefits would provide a better patient experience. Thank you.